Operations Officer. Our team is focused, next slide please, focus on the physical infrastructure to allow our response teams to address the space requirements to provide a response to our community, as well as look at the infrastructure moving forward as we see waves 2, 3, and 4 coming later this season, as has been specified, and subsequently if a vaccine is developed to allow the capability for having mobile clinics out in our community to allow for mass vaccinations throughout. So our focus is looking at physical spaces that will address logistics. You heard Dion Mack talk about how much PPE, all the material and equipment that's being stored in various locations throughout the community. We want to centralize that and have good control of those logistics or material for the OEM to be able to respond efficiently, as well as expand our lab capability as well at a single location. We're also looking for space for epidemiology and contact tracing. I just heard a very detailed explanation from David about the staffing levels. So we're making sure that we have the space to allocate to revamp or increase labor force related to epidemiology and contact tracing is going to be important, especially as we get into the colder months this coming season. In addition to that, we're also looking at drive-through testing and mobile clinics throughout our community. We're looking at 5 regionalized locations that will allow, again, our staff and our teams to be able to be out there in conjunction with our partners. You heard a lot of partnerships with the school districts, as well as our UMC and the county, to be able to utilize as many of these facilities as we can to be able to have service out in front of the communities. Next slide. The drive-through clinics in testing facilities, we've established some evaluation criteria that we've tasked our real estate consultant to evaluate as they sift through available properties throughout. We're looking specifically at locations, again, looking at the proximity and spacing to other health facilities, as well as some of our partners to try to maximize the availability to our community. We're also looking at the space to make sure that we have ample acreage and building facility and the parking availability, as well as anticipating queue lines as well. So making sure that we take that into account. We want to also have turnkey facilities. There's quite an inventory in our community of available space, specifically medical type facilities that may be available for us to jump on and allow our teams to be able to move in readily at these locations. Of course, cost will be an issue as well. We'll make sure we want to stay fiscally responsible as we make recommendations to council on these. And then the connectivity, both for transportation on the vehicle side, but also making sure that we have access to public transportation and allowing all members of our community to be able to access it effectively and efficiently. The move-in time, as I stated, again, being able to move in quickly as a turnkey facility will be critical moving forward. Next slide. I'm going to turn the presentation over to Kerry now to speak about the operational focus.
Good afternoon, Mayor and Council.